Thank you for joining our first live session of Indiana 211 University. We apologize for the technical difficulties that we had last week, but we're glad that you're joining us in the makeup session today. My name is Kevin Evans. I'm the Deputy Director of Data, Community Engagement, and Resource Curation for Indiana 211. We are hoping that you find these sessions valuable for yourself, for the staff that you shared the link with, and we're holding these sessions the third Wednesday of each month from 10 a.m. to 11 a.m. It is our hope that participants gain an understanding of Indiana 211, feel a sense of connection to Indiana 211, and most of all, you learn from the presenters ways we can enhance services that we provide to those across the state of Indiana. We've also ensured that you can count these sessions as additional education hours, as we are an approved provider of the professional licensing agency. And so with that, we'd like to take a moment to welcome you again to Indiana 211 University and look at our learning objectives for today. So we hope that you have a brief overview of Indiana 211, understand what to expect when calling Indiana 211, what a typical call and understanding kind of a community navigator's role or a call navigator's role, understanding our annual update process, our inclusion policy, and our resource curation team. Our mission at Indiana 211 is to improve the quality of life for Hoosiers by promoting equity and connecting people to the health and human service resources through highly skilled navigators, continuous community collaboration, and a robust community database and technological innovations. And you see that at Indiana 211 through the three ways that we provide this service. And so we have our community our call navigators, so our operations team. We have our community engagement team that's newly formed and out working in communities, doing presentations and booths. And then we have our resource curation team that are curating our resources and our database and keeping those up to date. What is 211? Indiana 211 is a free 24/7, 365-day service that connects Hoosiers with help and answers from thousands of health and human service agencies and resources right in their local community, quickly, easily, and confidentially. With Indiana 211, there are no eligibility requirements, income standards, nor any other rules. Anyone can call 211. And so we're going to look at what to expect when calling Indiana 211. And if you have any questions during the presentation time, you can type those into the chat. And Jill Shimon, our community engagement coordinator, will assist in letting us know that there are questions so we can answer those as we go along. Indiana 211 serves all residents of 92 counties in the state of Indiana. In 2023, we received over 160,000 calls, and we provided over 620,000 referrals. Our average call is about 10 minutes, with our top needs being housing, utility assistance, and food resources across the state of Indiana. We do have interpreters with Indiana 211 through a service that we have where individuals can access 240 languages so that we can ensure that the individual is getting their preferred language on the phone call with the navigator. We're much more than just a call. We advocate and we follow up. We have 62 available community navigator positions who receive 3 weeks of training. Community navigators are connectors to the community resources that our curation team are finding. They ask a series of social determinant of health questions in an effort to understand where a person is at the time of the call. Sometimes people call for one need, but in asking some additional questions, we discover that there may be other issues in which the community navigator can also offer resources. Often people do not know what to ask. This is a listing of the social determinant of health questions that we ask during a call. And so we could ask, what is the current employment status, or look at household income. We have the highest level of education. Do you currently smoke cigarettes? Do you currently have health insurance? What kind of housing situation are you in? Do you run out of food before you have money to buy more? In the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home? Do you have a lack of transportation that kept you from medical appointments, meetings, or work? And then how often does anyone, including family, insult, take you down, or threaten you with harm? And that really plays into the domestic violence question that we ask. And if you look at these social determinants of health questions on in211.org, we have a new data dashboard, and you can access most of these social determinants of health questions and see how they compare to your community. And that will be something that we really go into next week or the next month, is looking at these social determinants of health questions and how you can access that data. We're going to look at a sample call and see how those social determinants of health questions are used in the call process.
Thank you for calling Indiana 211. My name is Nick. How can I help you?
Hi Nick, I'm calling because I was told that I could call here to get some help with food. So that's what I was calling for, was help with food.
Sure. Well, I'm glad you called. I'd be happy to look and see what resources I can find for you today. Just to get started, have you called 211 before, or is this your first time?
This is my first time. I've heard about
Okay.
it through a neighbor.
Okay, perfect. And what's the first and last name for you?
My name is Mary Smith.
Okay, is that Mary?
Yes,
Okay, last name.
Smith.
Perfect. And what's a good phone number just in case we get disconnected today?
My phone number is 317-550-3300.
All right, perfect. And what's a good address so we can find the resources in your area?
My address is 1301 Judson Street. That's Evansville 47713.
Perfect. All right, thank you, Mary. And next, I'm going to ask some basic demographic questions. This will help me understand what resources might be available to you. May I have your age, please?
I am 35,
All right, and what gender do you identify as?
female.
Okay, and are you of Hispanic, Latino, or Spanish origin?
I'm not.
Okay, and what race do you identify with?
Uh, Caucasian or white?
All right, and have you or anyone in your household served in the military?
No.
Okay, and including yourself, how many people are in your household?
5 total. Myself, my husband, and 3 children.
All right, you said that's yourself, your spouse, and 3 kids?
Yes.
Okay, and is anyone in the household currently pregnant?
No.
All right, thank you. And may I ask some additional questions to see if there are any other areas that we can help with?
Of course.
All right, thank you. What is your employment status?
I work part-time at a daycare.
Okay. And what is your current yearly household income?
Well, our income has changed recently. So I'd say right now our income might be about $23,000 a
Okay.
year.
All right. And what is the highest level of education that you've completed?
I've gotten a GED.
Okay. All right. And what is your housing situation today? Do you currently have stable housing, or you have any concerns about losing your housing in the future?
I would say our housing is stable. That's something we always focus on, is making sure we can pay our mortgage.
Perfect. Okay. And in the last 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home?
We've gotten close, but we've never been threatened to be shut off.
All right. And within the last 12 months, have you worried about food running out before you could get more?
Yes, that's something we worry about often.
Okay. I understand that that can be overwhelming, so I am glad that you called to look for resources today. Do you receive SNAP benefits?
We do, it just doesn't last us long enough.
Okay, I understand. And in the last 12 months, has a lack of transportation kept you from medical appointments?
No.
Okay. Has a lack of transportation kept you from other things like work, meetings, or getting things you need for daily living?
No.
All right. And do you currently have health insurance?
Yes, we have HIP.
Perfect. And we've started asking all of our callers about their personal safety so they know how to get help for themselves or others. Does anyone, including family, ever insult or talk down to you?
No.
Right. Mary, I do appreciate you for answering these questions for me. I can go ahead and get started and take a look at some food pantries for you. Do you have any days of the week where you'd prefer to visit a pantry or no preference?
Mondays work best, but I think any day would be fine as well.
Okay, perfect. We'll take a look here and see what I can find. Just bear with me a moment. And while I am looking, do you have a pen and paper to take down some information for me today?
Yes, I do.
Perfect. Alrighty. Okay, so we have the first one pulled up here. So this is the Evansville Emergency Food Pantry Consortium. They are located at 1800 South Governor Street in Evansville. Okay, and that's 47713.
Should be close to my house then.
Perfect. Now, this is a part of a larger group of pantries that operate together. So this specific location is that of the Zion Missionary Baptist Church. It says here that you can visit one of any of these locations once every 30 days. So that would be this one, the Nativity Eastside Pantry, Patchwork Central, St. Matthew, St. Vincent de Paul, Westside Food Pantry, and Zion Missionary Baptist Church. So I'll provide this one, and then I won't provide any others. So that way you can visit this one once every 30 days. It does say that they provide perishable and non-perishable food to Vanderburgh County residents in need. Let's see here. It says,
So that gives you an idea of what a call looks like from a couple of our navigators who are actually our team leads who gave us this recording. And so we thank Nick and Jasmine for that. But it does show you how we look for resources and what that process looks like on the navigator side, as well as how we utilize those social determinants of health questions in asking those, but also looking for resources. There are 3 ways individuals can access 211 across the state of Indiana. They can call 211 or they can call our 866 number. You can also text your zip code to 898-211, or you can visit in211.org. We do have other call lines that are associated with Indiana 211. So we always, have childcare development fund of calls available. So we provide statewide CCDF referrals and answers, basic questions regarding childcare development funds. We also do facility complaints. So we can accept and investigate complaints, incident reports related to Indiana childcare providers. We also have facility referrals, so we can provide statewide childcare referrals. We also have that in Spanish. And then we have the DMHA Lyft line, so we can provide rides to and from verified substance use disorder treatment centers across the state of Indiana. We also have the substance use disorder information helpline, so we can do an in-depth assessment and provide referrals to SUD treatment centers. We also have the Peer Recovery Hub, which connects Hoosiers with substance use disorder to treatment and recovery supports through certified peer recovery coaches. We also have an Indiana Department of Health contract staff line, where we have statewide information line that answers questions and addresses concerns related to COVID-19 and also monkeypox. We have the rental assistance line with the Indiana Housing, the IHCDA. It completes applications for statewide IERA program. And we also have the EAP application assistance line where we can complete applications for statewide energy assistance program. We wanted to highlight with our operations side that there are 2 numbers in the state of Indiana. 988 is separate. It's with DMHA. But 211, we maintain a comprehensive database of community resources and provide information and referrals for essential services like food and clothing and shelter, financial assistance for rent and utilities, legal resources, domestic violence resources. And we do warm handoffs to 988 if we do get crisis calls to 211. and sometimes 988 does the same with 211. And so 988 offers a direct connection to compassionate, accessible care and support from a trained crisis specialist for anyone experiencing thoughts of suicide, mental health crisis, substance use crisis, or emotional distress. And so we did want to highlight there are two different numbers in the state of Indiana and kind of how those are utilized. We are going to turn over the floor to Morgan Price. She is the supervisor of resource curation, the training and quality assurance of that. She's going to go over our annual updates process, what our inclusion policy is, and then our resource curation team overview.
Thanks, Kevin. Good morning, everyone. You can go ahead and click over to the next slide. Okay, so for our current state of our active resources, we currently have 4,863 active agencies in our database. Under those active agencies, we have a little over 7,715 sites, and then we have 11,236 services. If we were to break down those agencies by type, half are nonprofit, 45% are government agencies, 4% are commercial, and then 1% are categorized as other. Other would be coalition groups or disaster-related resources. We do have 6 full-time resource curators on our team, and then we have 2 part-time community engagement curators. Our 2 part-time community engagement curators split their time up between the resource side and the community navigator team. Our resource team is responsible for gathering, updating, and entering data for new and existing resources. And then they also ensure that all resources are updated at least once a year. Resources in our database, like I just mentioned, are updated on an annual basis, and then our curators will do this by phone, email, or our Vision Link system will send out an annual update link. And then resources may also receive a partial update in between annual updates if we receive updates by agencies or receive updates by social media. At any point throughout the year, you can submit changes on our website. So you would just go to in211.communityos.org. You would just click on the very top of the screen, community agencies, and then you would just click on search and update your community organizations. You would then just type in your agency name or search by your address. This will then pull up your agency record to review all the programs and your address information. You'll then be able to click on that blue button that says request an update to agency service or site details. Our curation team will then review any update requests received within 2 business days. And then on the bottom of that form, you do have the ability to request additional assistance from a resource curator, and then we will reach out by phone or email to you. And then we do have an inclusion policy for all of our resources, and then that makes sure that we collect and classify the most comprehensive, accurate, and up-to-date information for all community organizations across Indiana. All of our resources in our database must fall under the basic needs, health, human services, consumer, educational, environmental, or disaster-related category. And then they also must be operating for at least 6 months before we include it in our database. So we will include agencies like government agencies or program, crisis lines, hotlines or helplines, community, nonprofit, or faith-based organizations, and then community collaborations or coalition groups. And then we will consider agencies like for-profit agencies providing sliding scale fee structure, scholarships, or reduced fee programs. And then we will always exclude agencies that deny people based off of race, gender, or sexual orientation, or if they offer programs that are for members only that our callers cannot access directly. So if you notice that you're not in our database and you want to be included, you can go to our website and then you would just click on the community agencies button again. We do have our inclusion policy listed there that you can review, but you would just click on the second link listed, the inclusion request form. You would then fill out all the information about your agency and all the services that your agency provides. Our community engagement team will review that form within 3 to 5 business days and then reach out to you if you meet our inclusion policy. From there, we will then add your agency to our database. If you have any questions about the information that we went over today or how we can add you to our database or update your information, please reach out to our team Monday through Friday, 8 a.m. to 4:30 p.m.
Thank you, Morgan. We wanted to highlight some of the upcoming Indiana 211 University topics. August 14th is going to be our Indiana 211 Community Engagement Team. We highly encourage you to attend this session. You're going to learn really how Indiana 211 is engaging communities across the state of Indiana. And also you're going to learn how we look at our data, utilize data, but also how you can access Indiana 211 data on a dashboard that we have created. You'll also be able to get a look at our guided search that we have at Indiana 211 that we're in the process of creating and releasing here in the next few days. You'll also be able to access our community engagement team and learn how to get data requests, how to ask for marketing materials, and also how to request a speaker or have us be present at a booth. And then September 18th, we have suicide prevention and crisis intervention with the Indiana Department of Mental Health and Addiction and 988. That is going to be a really great session to attend to learn how Indiana Department of Mental Health and Addiction and 988 are impacting suicide prevention and crisis intervention in the state of Indiana. And then October 16th, we have a domestic violence awareness presentation. Again, it's important that if you're in this session to share the link to these sessions with other individuals that maybe are your coworkers or in community coalitions with you, because these do count toward continuing education credits, but also it's a great way to learn ways that we can impact those that we're serving in the state of Indiana. We will have a link in the chat posted here for you that you can take a moment to provide feedback on the session today, but also that you will be able to provide us an opportunity to get ideas from you of topics that you might be interested in us bringing together, whether that's individuals from the state of Indiana that are professionals on topics, or also in community organizations across the state of Indiana that we have connections with. So if you do have suggestions of topics, we highly request those from you. But that will conclude today's session, and we will see you again on August 14th.